Regarding the digital, the special test, I would do Allen test. In Allen test, I will occlude the radial and ulnar arteries and ask him to make a fist 4-5 times, and then ask him to extend the fingers. Then I will release my pressure and see if the capillary fill and the fingers color changes. Test will repeat it for the radial side as well as the ulnar side, and similarly I can test for the digits. The Elson test is to check the integrity of the central slip. So what I will do is I will ask the patient to flex the hand. My fingers will hold put a pressure on PIP joint and ask the patient to extend the finger. If the patient is able to extend, then at that level I will try to palpate the DIP joint. If DIP is tight, this means the lateral bands are functional and the central slip is disrupted. On the other hand, if the DIP joint is lax, this means that central slip is intact. Then there is a test, Brunel litter test, in which we check the extrinsic or capsular tightness. As intrinsic muscles are function as a flexion of metacarpophalangeal joint and extension of the DIP and PIP joints. I will first of all check the patient's range of motion and check for PIP movement while in the position of intrinsic minus hand. From extension of the metacarpophalangeal joint, I will check the range of PIP joint and then flex the metacarpophalangeal and check the range of motion again. If it improves when metacarpophalangeal joints are flexed, this means there is intrinsic tightness. If it remains the same, it is capsular tightness. Finkelstein test is for De Quervain disease. I will ask the patient to hold the thumb in the palm and try to do a dorsiflexion. In that way, if the patient feels the pain at the level of the first dorsal extensor compartment, then it's positive. Kirk-Watson test, basically I will hold the scaphoid tubercle and put the patient ulnar deviation, and then with the force applied on the scaphoid tubercle, I will try to extend and radial deviate the wrist. The basic concept is that from radial deviation to ulnar deviation, the scaphoid tries to extend, and when the force is applied already, there is a feeling of clunk or a pain. I need to compare it with the opposite side itself.